This is lab 14 on the dog specimen. So we will continue on our thoracic limb today, which means you have to remove the skin from the elbow down to the paw. You don't have to do all the individual toes, you can just kind of go down and take it off. I did all of mine, but you don't have to do that. So just go down to the toes here and then just take the skin off. So we'll start with the veins that you want to see today. First of all, we'll start with the cephalic. So cephalic, everybody usually can find at least part of the cephalic unless it was taken off with the skin. So you have cephalic there. I'm just going to lift this up a little bit. And so this is actually cephalic over here and then comes up, and this is accessory cephalic coming in and joining that. So accessory cephalic, just cephalic, and then cephalic running up here. All right, then we have axillobrachial vein here, going through underneath deltoideus, so axillobrachial. In the dog, you have this omobrachial vein here that's going up to join the jugular. And that, in this dog, it's really, really tiny, but some dogs you will have a nice big vein coming across here that's easy to see, and in some dogs you won't be able to find it at all. So that one's a little bit variable. So just do your best on that one and try not to get frustrated. All right, the median cubital vein is actually going across. Here, I'll lift it up just a little bit. And here, median cubital is joining the brachial vein on the medial side with the cephalic on this cranial aspect here. So median cubital is right here. Oops. There. And then we have cephalic, so you have cephalic continuing and it goes underneath the brachiocephalicus, and that goes up to join in with the jugular also. So you can uncover that if you have a nice injection. And that will be it on the veins. And we'll move on to the other side. We'll move to the medial side and look at some arteries and nerves. So here, we did all of these yesterday, or on the previous lab. So here we're moving down into the anabrachium. So after you take off your skin, you have to incise the fascia like we did on the other side when we did the limb, and just kind of peel it back and be careful not to cut nerves and vessels this time. So we'll continue following the brachial artery. So let's find it up here where we had brachial coming down, and you'll cut the pronator teres, and pretty much any muscle that's in your way you can cut and just move it like that. So you'll have a nice clear path to follow. So brachial artery here, and then you'll be looking for the common interosseous artery. So in the dog, we have a common interosseous. In the cat, we won't have that. But here's the common interosseous. This one is a little bit different than some of them will look. We have the ulnar actually coming off at the same point, but as a separate little branch here. So the ulnar artery here, and then common interosseous going a little bit deeper. But we'll say that ulnar comes off at the same point as common interosseous. Well, actually, I think ulnar is actually going to be this one going back. So here, if I put my forceps around it, you can actually flip to the caudal side and just verify that that one is ulnar. So you just move the muscles, and yep, there's my forceps. So you can see ulnar coming out here and giving off some branches. So that piece will be the ulnar artery. So a lot of these arteries you have to kind of go with where they're going and not necessarily the branching pattern they're supposed to follow. So then we have the rest of common interosseous. Hopefully you can see that diving down here. So common interosseous. And then you have two branches on there. And you'll want to look at the caudal interosseous and see just the beginning of cranial interosseous. So caudal interosseous is here. And you have to take out some of that pronator quadratus muscle that's in between the bones and just follow that down. So hopefully you can see that. And then the cranial interosseous. So if you lift up the common and kind of pull it away, it will be this one diving down deep. So that will be cranial interosseous, just kind of diving in that hole there. right, then we'll move on and find, so then we have the median artery, so another name change. So brachial artery then changes to median artery here after that common interosseous is given off. And then you have this little piece that's the deep antebrachial going to some of these flexor muscles here. And then you'll continue to follow median artery down and look for this small piece going a little more cranially, and that will be the radial artery. And then median will continue down, and you'll follow that down into the paw. So cutting through that flexor retinaculum and following that down. And what you're looking for is really just this superficial palmar arch. So just this kind of arch right here that is giving off these branches. So the superficial palmar arch. And then you have palmar common digital arteries. So you have, these are all palmar common digital arteries coming off of that arch. All right, then we just have a few nerves to cover, which we've already looked at most of these. So the radial nerve was the one we found diving deep into the triceps. So way back up here, we had radial nerve, but we will flip it to the lateral side in just a minute and look at the branches of that. But before we do that, we want to look at the median nerve, the continuation. So you had median nerve, and you really just follow it all the way down, like that. And then you'll have the ulnar nerve. So we're just continuing to follow it. So we found it on the last lab, and you'll just continue to follow ulnar, and then kind of go to the caudal aspect and separate the muscles again, following that ulnar nerve down. And then it will branch, and it has two branches. There's a dorsal and a palmar branch. I can hopefully pull that out. So here, this little one coming off right here is going to be the dorsal. So it's going to the dorsal aspect of the paw. So dorsal there, and palmar is much bigger. So this piece is the palmar nerve, or palmar branch, going down into the paw on the palmar aspect. And that should be it for lab 14. Oh, I'm sorry, we have to flip it over, do the lateral side of the radial. So you reflected, or hopefully will now reflect, your lateral head of the triceps. And then you have that radial nerve coming out, and you'll follow it until you see the branching. So here you have a superficial branch here. You'll see going to the cranial aspect of the antebrachium. And then you have a deep branch here, diving down into the muscles. And those are both off of the radial nerve. So you're just looking at it on the lateral side versus the medial side. Okay, now that should be it for lab 14.